Newsfirst, Newsline.
Hello there, a very good evening and welcome to another edition of Newsline, coming to you live and direct from our Newsfirst studios here in Colombo. As much as we cover current political situation in the country, we've of course been dedicated to educating the general public on the COVID-19 pandemic that is spreading in the country and how the general public should act in these trying times as far as the quarantine measures, the health guidelines, and also on the economy, the situation of the economy during this pandemic situation in the country. Today, we will be focusing, of course, with the country looking towards reopening in the near future. We will be focusing on how the general public should act once the country reopens, and also what is the current situation surrounding the COVID-19 pandemic here in Sri Lanka. And to discuss these matters and more, we've got with us on our show today via Zoom Professor Indika Karunatilaka. He is the former chairman of the Sri Lanka Medical Association. A very good evening, Professor. Thank you very much for taking time off your busy schedule to join us via Zoom today.
Very good evening to you, Shalan, and very good evening to all our viewers as well.
Professor, now, the decision that was reached a few days ago to extend the quarantine curfew until the 1st of October and then reopen the country periodically from the 1st of October. The decision to extend the quarantine curfew was reached with a consensus that the country will be reopened on the 1st of October. Is the situation in Sri Lanka right now conducive for this to take place?
Yes, I mean, if you take the situation 1 month ago, where the hospital system or the health system was going beyond the capacity and the number of patients were increasing and also the number of deaths increasing, compared to that situation, we can see a tremendous improvement at the moment. The number of cases being reported or the test positives are going down, and also the number of ambulance transfers going down. And if you take the information or data that is coming from the health system, the number of oxygen dependent patients, and that's also reducing. And previously the health system was basically overflowing. It was not possible even to get a bed from government or private sector, but now the situation is different and beds are available. The health system capacity is now able to cope up with the numbers that are coming, and that is supported by many other data also. For example, the emergency ambulance transport, and also the number of calls that we are getting in different patient helplines. Taken together, we can see an improvement, and probably there can be several reasons for this also. One could be the increase in awareness of the public and sometimes the anxiety due to the previous very serious crisis situation that we were facing 1 month ago, and also the reduction, the mobility restriction could have played a role. And in the vaccination, now the country has completed over 50% of the total population, which is a very positive thing indeed. So it also may be coming into effect gradually. And similarly, several activities like the integrated patient management system that were introduced recently, all these things together, I'm sure there is a synergistic effect. So it's a good news indeed.
Professor Indika, now with the country preparing to reopen like this, of course, with things going back to normal, there will be a tendency to repeat previous mistakes. Now, we've been through the COVID-19 for about a year and a half, a little bit more than that maybe even. And during this time, every time the country reopens, people go back to their normal lives a little too soon. Then you have unpopular decisions maybe that are taken by various authorities, and then you have people going and protesting against it. Also, you have events, even sometimes sponsored by the government, where there are many participants who are not following COVID-19 health guidelines. People tend to forget. And speaking practically, Sri Lanka doesn't have enough of police officers and public health inspectors to go to each of these places and strictly enforce all of these regulations. So on moving back to a normal or the new normal situation here in Sri Lanka, what are your views on possibly repeating mistakes of the past by people who are angered by the authorities' decisions, who go and stage protests, who, well, maybe hold some events, even maybe government events. What are your views on this?
Okay, so you mentioned about the normal situation that was there previous. One thing we have to be very clear about is in these kind of crisis situations, what we are talking about is not really going back to the normal, but we talk about new normal, the COVID-19 new normal. So the idea is that after a crisis like that, the society will not be able to go back to the same normal way of life that was there before the crisis situation. That's why we talk about new normal situation. It's an adaptation. It's an adaptation to this situation and making sure that the spread of the epidemic it will be kept under control, and our lifestyle, the way of moving ahead with life, and also other areas like administration, transport, all these areas are adapted to the new normal. So the basis in the new normal would be that the countries should move forward. At the same time, we have to take measures to prevent another super spreader event like this. So that's very, very important. And to do that, to move into new normal, I think we need to make sure that the systems are in place to move into new normal. I'll give one example, say transport. Our transport system, the what we had before in Sri Lanka, probably as everyone know, especially if you take the public transport, it's not ideal. Everyone accept that there are many challenges, many logistical issues, and there are several other maybe political, maybe administrative issues. It was not ideal. So now I think it is time for us to think about how can we introduce such systems in place. Say in transport, how can we adhere to the new normal to make sure that it is not another catalyst towards another wave or another surge. So that is very, very important, how to make sure that you maintain the transport in a way that the distance is minimized and the sanitization is happening, and at the same time we make sure that the essential services are maintained and the necessary transport is provided. So all these things actually need a system change from the system that has been there previously. So that's one example. Another example may be patient education. Now, when we so many patients were coming up during the surge 1 month ago, there was a need for a system to identify the patients who need immediate admission to the hospital and the immediate treatment. So those systems need to be in place, and there should be a system where the patients can always communicate and find out what are the solutions for their problems and what to do during crisis situations. So, and also say the supplies, the supply chain management, essential provisions. So all these systems need to be in place. That is why we call new normal. So new normal is not just adhering to the preventive measures, but making sure that our systems and processes are adapted in such a way that the country moves forward. At the same time, the epidemic is kept under control. So I think that's very important.
Professor, on the issue of people gathering and of course adhering to COVID-19 guidelines, what sort of measures do you propose on gatherings once the country reopens on the 1st? Should weddings, events, public functions, and even protests be allowed to take place? What is your stance on that, as a medical professional, of course?
Yes, I mean, I try to speak based on the science and then the medical principles of the health promotion and the health. The basic thing about this epidemic is it is spreading fast in areas or the settings where a lot of crowds are gathering, not adhering to, say, the health precautions like we are in mass sanitation, so on and so forth, especially the confined spaces with poor ventilation and many crowd. And especially if they are talking, eating, and making noises, all these things lead to a very rapid spread of, of infection. So whatever event, regardless whether it's social or cultural or religious or political, regardless, if any event that falls into category where large crowds are gathering together in a small space, poorly ventilated, poor hygiene, sanitation, large numbers, making noises, talking, singing, whatever, That setting, those settings has to be controlled. Yeah, actually, I mean, you can, when you go out in the road, you may see a lot of vehicles moving and a lot of people. Yeah, I mean, we need not be too worried about that, because people need somehow, they need to basically get their daily needs, so on and so forth. What we need to be, I mean, I'm not saying that there's no danger. There is some danger. Say people who are having the infection, if there is no control, if they can move out to the community and to different places, definitely there is a risk. But what we should be very concerned is about mass gatherings with the criteria that I have mentioned, the risk situation that I have mentioned. Those are the super spreader events. Those are the events that even the current control is there, but those are the events that carry the risk of another super spreader.
Professor, now even this view came from India as well. There were certain authorities in India that were saying that within the next 6 months, the COVID-19 pandemic in India will become an endemic. And then measures such as quarantine and lockdowns may not be effective anymore. I believe there were some medical professionals here in Sri Lanka too who expressed similar sentiments about this pandemic eventually turning out to be an endemic in Sri Lanka as well. What really is this? An explanation to the public, if you will.
Okay, I mean, I suppose it is too early to comment whether this is going to be endemic. I mean, endemic means it will remain there in at a baseline and maybe surging from time to time. It's too early. It's too early to say that. I mean, some time ago, not anymore, malaria was endemic, but not anymore. So, but it's very much early days to comment on that. But as it looks like that COVID will be with us for some time to come, and it's not going to go away in a hurry. So that is there. I mean, but at the same, if you ask me when this is going to end, I think your guess is as good as mine.
Also, Professor, we've seen the vaccination drive taking place across the country. We will speak more about the vaccination drive after a commercial break, of course, that will be coming up soon. But just before we go into that, Professor, if I can sneak in just one more question. There was a report yesterday by field officers of the Ministry of Health that said that 100,000 people above the age of 60 have still not been vaccinated. Is this alarming?
It is actually, because I mean, in a situation where the more than 50,000 of the country's population been vaccinated, and if you look at the say death rates due to COVID-19, the deaths are highest among those who haven't got the vaccine and those who haven't completed the 2 doses of the vaccine, and also in the elderly category over 60 years, and those with say comorbid conditions like communicable, non-communicable diseases like diabetes, hypertension. So this is one priority category. When WHO and the Ministry of Health came out with the vaccine rollout plan initially several months ago, it was very clearly mentioned that those high-risk categories need to get the vaccine. So I think there need to be a really good communication or the social mobilization program to encourage them to get the vaccine, because now actually the vaccination program, I'm not saying it's ideal, there are no drawbacks like in any program, especially in a crisis situation, but since the vaccination program is now rapidly progressing, I think we should encourage everyone to get the vaccine as soon as possible, and the available vaccine as soon as possible.
The first vaccine that you can find is the best vaccine that you can get. That is what authorities have been telling the general public over and over again. And of course, the wise general public of Sri Lanka would accept that and get themselves vaccinated because we, of course, here in Sri Lanka have some of the best health professionals in the world. We will cross over to a short commercial break and on the other side discuss more about the COVID-19 pandemic and the reopening of the country that is coming up soon. Stay tuned. You're watching Newsline. Welcome back. You're watching Newsline, and we're in discussion with Professor Indika Karunathilaka about the reopening of Sri Lanka that is coming very soon and how cautious we need to be when this reopening takes place. And of course, in general, regarding the COVID-19 situation that is currently prevailing in Sri Lanka. Professor Indika, before we crossed over to our commercial break, we were discussing about some serious concerns on the fact that 100,000 people here in Sri Lanka, members of our senior citizens of Sri Lanka above the age of 60, have still still not been vaccinated. Professor, why do you think 100,000 people above the age of 60 have not been vaccinated yet? What is the reason for this?
Yeah, I think the reasons can be multiple, and probably it is more related to the about getting the message across successfully to relevant groups. Now, you mentioned about the elderly group, the group about 60 years, but at the same time, we see some vaccine hesitancy even among younger groups. So that is something concerning. We really don't see the very strong anti-vaccine lobbies like that is seen in other countries. Because Sri Lanka has a very long history, very strong history of public health and vaccination and immunization, and all of us are healthy and disease-free due to the strong vaccination program that has been there in this country for last 40 years. So we have a very strong system and a strong belief system also. Generally, the belief is the vaccines is a must and it's very important for health. At the same time, we see some misinformation going around related to vaccines and some kind of vaccine hesitancy happening. And sometimes we see even comparison between different vaccines happening, and sometimes it can go into some irrational levels also. And that has been somewhat harmful because, I mean, if you take the public health perspective, we have to control this disease as a society and a community. In that case, the important answer is getting the vaccine and not what is the vaccine that we are getting. So I think that message need to go into the relevant communities and relevant categories quickly, because sometimes we really see this comparison, which is quite, this can lead to irrational decision making and some vaccine hesitancy. And there are a lot of myths also going around. That's another thing. I mean, for a country that has a long history of immunization and vaccination, there are a lot of history. I mean, sometimes can be very kind of hilarious also. For example, say nanoparticles can be incorporated and that will change your genetic pattern. So those kind of unbelievable misinformation is going around, and sometimes even in social media.
Professor, one of these this misinformation that you speak about, we also saw Professor Nilikar also speaking about this, and what she highlighted was the fact that there is a lot of misinformation, and especially for the hesitancy among the youth to go get this vaccine, people between the ages of 20 and 29, to get this vaccine. There was this piece of misinformation that said that getting vaccinated could lead to sexual impotency. What are your views on that, Professor?
Yeah, I mean, the same answer is same baseless as the previous one regarding the nanoparticle, the chip that is inserted into the body. So it's same argument. I mean, only thing is these kind of baseless misinformation, they spread very rapidly and very fast because they are so catchy. And I mean, when we talk about the need for herd immunity or reduction of mortality or reduction of morbidity, they are not very catchy. But these kind of misinformation, if you notice social media, now we have been actually, with the support of Health Promotion Bureau, we have been observing the patterns, what is happening in the social media. So it is spreading very rapidly and sometimes quite disturbing, because there are groups of people who are got together and then promoting these kind of misinformation and myths in an organized way. So that is something rather disturbing. So I think the health promotion authorities or the health education, public health authorities need to strengthen their approach, especially I think into the social media. It's very important because social media can be very powerful weapon in both ways. It can be very useful. At the same time, if misused, it can be damaging also. So I think if we have to reach the younger population, we need to think about those strategies, because it's very disturbing to see that, the younger population are the ones who should be really proactive in this kind of activity and thinking about their health, and educated, supposed to be educated. So it's quite surprising also.
Professor, now there is another controversial subject, of course, with regard to the need of vaccination cards to travel around. The Minister of Health announced today that they are looking into this matter, they are looking into the possibilities, they are looking into the legal side of bringing in such a regulation here in Sri Lanka. But of course, the regulation is to promote the vaccine, to promote people from getting the vaccine. However, Professor, the people have, well, a right of choice at least to choose what form of medication that they want to get. So, balancing out these two, how do you think that Sri Lanka should proceed in the future in encouraging vaccines? Is a vaccine mandate one way that we should be looking, one thing that we should be looking at to encourage the vaccine?
I think we should go that path. I mean, we should go the positive path of promoting vaccination and getting as many people to get vaccinated. I mean, when you talk about the rights, I mean, true, definitely there could be a rights issue if you are to make the say vaccination card mandatory. If you take the public health perspective, there is a point in that. If you take the public health perspective, there is a point in that. In that way, you can identify those who can be safely included or admitted into the transport systems or the working systems. So the planning could be easier in that sense, because I mean, we are talking about, when you talk about the new normal, then we are talking about restricting crowd gatherings and while maintaining essential services. So when we decide who are the people who should come for these services and who can basically attend to these services without a risk to themselves or others. So in that case, having this certification is not a bad thing. But the problem is, it's all about systems. So here also, now previously I mentioned about the need for systems. So it's all about systems. If we have a good system where the vaccination card can be issued within short time without inconvenience to everyone who has got the vaccine, then implementing this kind of a thing could be easier without much inconvenience. But I think we are some way away. We are still developing our systems and processes. The epidemiology unit has, they have very correctly, and we need to appreciate that. They have started this process of registration. They are issuing a very nice register, a certificate which can be produced anywhere in the world, which is quite informative. But the thing is, it will take some time for the kind of, say, very smooth and seamless issuing of those certificates. So once we have those systems in place, it may be worthwhile considering this, not in a punitive way, but in a positive way, to identify those can be easily allowed without too much of a risk into the different systems and essential services. Let's take it in that way.
Professor, also judging by the approaches of that other countries have taken, now there have been such regulations brought in some European countries who have a very good human rights record. So of course they will be looking at imposing such regulations in Sri Lanka as well. In other countries, in Western countries, some areas, especially in the United States as well, people who have been fully vaccinated, gotten both doses of the vaccine, are no longer required to wear masks. So removing the requirement for masks could also be a way of promoting getting this vaccine. Do you think that the government or the health authorities in the country should be looking at that aspect as well?
Probably, I mean, as far as I know, not at the moment. There is a point in what you say, but I think better to go on the safer side, always to go on the safer side, because in one way, mask has a protective effect in reducing respiratory infections anyway. So that can be helpful in general, because I mean, when the mask wearing has increased, there was a noticeable drop in respiratory infections during one time period. And also it gives a message. It gives a message that I am careful, that you also need to be careful. So there is some positive health message in a universal mask wearing. So I don't think health authorities in Sri Lanka will take that decision in a hurry. As far as I know, there is no such decision at the moment.
Also, Professor, speaking on a controversial decision, of course, that was taken recently, where the Ministry of Health, Director Generals of Health Services, the Deputy Director General of Health Services came out and said, we were not involved in taking this decision, was the decision to reopen taverns. Now, this decision seems to have no decision maker. In the current times that we're in, how wise is this decision? Is this a decision that should have been taken?
First of all, I mean, I'm also not aware of the basis or how this decision was taken. I don't think many are. And as far as I know, there is some legal procedures or court case that is being processed. I'm not really aware, so I would avoid going into much details regarding that. But the same principles apply. The same principle is when there is a lot of crowd gathering and lack of adherence to the preventive measures, then whether it is social or cultural, whatever, that could lead. There is a risk of leading into a super spreader event. There's no doubt about that.
So, according to what you said before, if I gathered it quite correctly, if people are fully vaccinated, there is a possibility of allowing them to gather in groups if they are fully vaccinated, because the risk is less.
Okay, again, I think we have to go by the basic principles similarly, because there is no assurance that, at the moment also, there is no assurance that it will be possible to implement the vaccine card rule in that. So there is no assurance that a larger gathering will not have those who are unvaccinated. Risk would be very much low, but there is no assurance. So I think again best is to go by the principles, the combination of different approaches, and reducing gathering. The principle of reducing gathering, I think, should be applicable to any area, whether it is, say, the industry or the commercial, education, whatever area, the same principle should apply, at least till we gain control over this situation.
Professor, we're in the final few minutes of the show. We are planning on opening up Sri Lanka. The country is planning to open up on the 1st of October. Maybe not all at once, but methodically. Anyone who is watching our show would already know that though we are under quarantine curfew, there are many people on the roads. There are shops that are open. Wine stores have been legally given permission to open, but that there are things that maybe not approved by the health authorities, but that are still taking place in Sri Lanka. Professor, how do you think it'd be best for the general public to act? What's the best course of action that the general public can go to once the country is reopened on the 1st of October?
I suppose responsible behavior. The taking the responsibility to ourselves also very important. Being aware of all these responsibilities like getting vaccinated, adhering to the preventive behaviors, and also making sure that you avoid those situations. Even though the country reopens, ideally it has to be step-by-step manner if you have to prevent another super spreader event. So a lot of responsibility lies with the general public also in adhering to those measures and making sure that unless essential you don't go into gatherings, and unless essential you have to restrict your mobility. So those basic principles and the basic things like the universal mask wearing, sanitation, that's what we can do as general public. That's what we can do. So that's very essential.
Thank you very much, Professor Indika Karunathalaka, for joining us on our show, and of course, as usual, educating the general public on what they should do, how they should act to save themselves, to save the country, to save their loved ones during these trying times here in Sri Lanka. Thank you very much, Professor, for joining us on our show.
Thank you very much.
And also a big thank you to all our viewers out there for tuning in to Newsline. Of course, as always, we do remind you to stay at home as much as you can, stay safe, go out only if there is an essential need, and of course, one additional request, get vaccinated as soon as you can. Also articulated by Professor Indika Karunathalaka and the health professionals of Sri Lanka and the world. Let's get through this together. Thank you very much for tuning in to Newsline. Take care and God bless.